Which blood component is most appropriate for correcting an elevated INR in the setting of active bleeding post-CPB? A. Cryoprecipitate. B. Platelets. C. Fresh frozen plasma, FFP. D. Packed red blood cells. Answer: C. Fresh frozen plasma, FFP. Explanation: FFP contains all clotting factors and is the treatment of choice for reversing elevated INR due to coagulation factor deficiency in bleeding patients. What is the most likely cause of thrombocytopenia following prolonged cardiopulmonary bypass? A. Dilutional effect. B. Hemolysis. C. DIC. D. Liver failure. Answer: A. Dilutional effect. Explanation: hemodilution, platelet consumption, and sequestration are major causes of thrombocytopenia after prolonged CPB. Which agent is used for heparin reversal at the end of CPB? A. Tranexamic acid. B. Desmopressin. C. Protamine sulfate. D. Vitamin K. Answer: C. Protamine sulfate. Explanation: protamine sulfate binds to heparin and neutralizes its anticoagulant effect, allowing safe decannulation and hemostasis. A patient post-CPB is bleeding despite normal ACT and platelet count. ROTEM shows prolonged clotting time, CT. What is the next step? A. Give cryoprecipitate. B. Give fibrinogen concentrate. C. Transfuse platelets. D. Give FFP. Answer: D. Give FFP. Explanation: prolonged CT on ROTEM suggests deficiency of coagulation factors, best corrected with FFP. In blood conservation, acute normovolemic hemodilution is best done. A. Postoperatively. B. During cardioplegia. C. Pre-incision, before CPB. D. After protamine administration. Answer: C. Pre-incision, before CPB. Explanation: this technique removes some of the patient's own blood before CPB and replaces it with fluids, minimizing red cell loss during surgery. Which of the following is not a feature of disseminated intravascular coagulation, DIC, post-CPB? A. Low fibrinogen. B. High D-dimer. C. Thrombocytopenia. D. Isolated elevation of hemoglobin. Answer: D. Isolated elevation of hemoglobin. Explanation: DIC typically shows consumption of clotting factors and platelets. Elevated hemoglobin is not a feature. Which antifibrinolytic is a lysine analog used during cardiac surgery to reduce bleeding? A. Desmopressin. B. Tranexamic acid. C. Eptifibatide. D. Argatrobin. Answer: B. Tranexamic acid. Explanation: tranexamic acid is a synthetic lysine analog that blocks plasminogen activation, reducing clot breakdown and surgical bleeding. When protamine is given too rapidly, which adverse reaction is most likely? A. Hypertension. B. Bradycardia. C. Pulmonary vasoconstriction and hypotension. D. Hypokalemia. Answer: C. Pulmonary vasoconstriction and hypotension. Explanation: rapid infusion of protamine can cause histamine release and pulmonary hypertension, leading to sudden cardiovascular collapse. What is the primary benefit of cell salvage during cardiac surgery? A. Reduces infection risk. B. Reduces platelet activation. C. Reinfuses the patient's own red cells. D. Prevents fibrinolysis. Answer: C. Reinfuses the patient's own red cells. Explanation: cell salvage collects, washes, and returns the patient's own RBCs, reducing the need for allogeneic transfusion. Which of the following parameters on ROTEM indicates fibrinolysis? A. CT, clotting time. B. MCF, maximum clot firmness. C. Li30, lysis index at 30 minutes. D. A10, amplitude at 10 minutes. Answer: C. Li30, lysis index at 30 minutes. Explanation: Li30 represents the percent of clot remaining at 30 minutes after formation. A low Li30 indicates increased fibrinolysis.